Many people say my BMI is normal, so I am fine. But if you are an Asian, that same BMI can still mean a much higher risk of diabetes, blood pressure problems, and heart disease. I am Dr. Raj Prakash, and today I will explain you why the BMI cutoffs are different for Asian and Caucasian bodies and what your number really means for your health. First, what is BMI? BMI stands for a body mass index. It's a simple number calculated from your weight and your height. Doctors use it as a quick screening tool to see whether your weight might be putting your health at risk. Now, it does not measure the actual body fat directly, and it is not a perfect number, but it gives a rough idea of whether you are underweight in a healthy range, overweight, or at a level that may increase your risk of problems like diabetes and heart disease. For most Caucasian adults, the classic BMI ranges are below 18.5 underweight, 18.5 to 24.9 is normal weight, 25 to 29.9 is overweight, 30 or more is obese. You will see these numbers on many charts, apps, and websites. But here is the important point. These numbers do not work the same way for everyone. Research shows that at the same BMI, many Asian people have more body fat than Caucasian people. They also tend to store more fat around the tummy area, the central or abdominal fat. This type of fat is more strongly linked with type 2 diabetes, high blood pressure, and heart disease. That means an Asian person can look slim, have a BMI that looks normal on the standard chart, but still carry a higher health risk. Because of this difference, the World Health Organization and other expert groups suggest lower BMI cutoffs for Asian populations. For many Asian adults, the range often used are below 18.5 underweight, 18.5 to about 22.9 is the healthy BMI, 23 to about 27.4 is overweight, and 27.5 and above is obese or high risk. In simple terms, an Asian person with the BMI of 23 or 24 may already be at a higher risk of diabetes and high blood pressure, even though a Caucasian person with the same BMI might still be classed as normal on the old charts. Why is this happening? Studies show that the Asian group often have 2 to 5% more body fat than Caucasian at the same BMI, and more of the fat is stored around the abdomen. This body fat pattern makes it easier for blood sugar, cholesterol, and blood pressure problems to appear at lower BMI numbers. So, BMI 23 or 24 is not just a harmless number for many Asian bodies. It can be an early warning sign. Now, what should you do with your BMI number? First, treat as a warning light, not as a judgment. It's not about blaming or shaming. It is about awareness. If you are Asian and your BMI is 23 or higher, it is a sign to check your waist size, check your blood pressure, check your cholesterol, check your fasting blood sugar or HbA1c with your doctor. Do this even if you look lean or your friend says you are thin. Don't worry. If you're a Caucasian, the classic cutoff signs still give a useful guide. But remember, BMI cannot see muscle, bone structure, or where your fat is stored. A very muscular athlete and someone with high body fat can have the same BMI. So, context matters. Second, focus on habits, not just the numbers. Your health improves with better daily choices, even before the BMI changes. Key habits that may help at any BMI are: number 1, regular physical activity, a mix of walking, strength training, and movement you enjoy. Number 2, more whole foods like vegetables, fruits, pulses, nuts, and good fats with fewer ultra-processed and sugary food. Number 3, good quality sleep and managing stress. Number 4, not smoking and limiting alcohol. Number 5, losing even a small amount of weight, especially around your waist, can significantly reduce the risk of diabetes and heart disease, particularly if you are an Asian and in the overweight range by Asian cutoffs. And finally, remember, BMI is useful starting point, not the whole story. It is one tool among many, along with the waist size, blood test, blood pressure, and your family history. Ask your doctor how your BMI should be interpreted for your ethnicity, your age, and your medical conditions. Use it as a guide to better lifestyle choices, not as a label on your self-worth. Thank you for watching. If you found this helpful, please share it with your family and friends, especially anyone who says, I am fine, my BMI is normal, but has never been told that the cutoffs are different for Asian and Caucasian bodies. This video is for general education purposes only, and it is not a personal medical opinion. If you are worried about your BMI, your waist size, or risk of diabetes and heart disease, please speak to your doctor or a qualified specialist for individual advice, and do not hesitate to seek a second opinion if you need more clarity. See you in my next video. Until then, goodbye. Thank you.